Hello, everyone. My name is Ying Yin. I am a research assistant professor at George Washington University Biomedical Informatics Center. My background was in pharmacology, and I have been doing medical informatics research for the last 5 years. And today is my honor to present you this lecture, Demystifying AI. Let's set up some expectations. So you don't need to have a technical background to follow the course. I will generally introduce you of the healthcare challenges and some history of AI in healthcare and some current and future research directions in healthcare applying AI in the healthcare industry and the research. And I will also gently introduce you some of the jargons in the deep learning and AI field. I hope by the end of the day, you have a better sense of AI and how you could potentially imagine AI in your work field. So before we dive into the healthcare, AI in healthcare, take an overlook at the healthcare system first. So at the core, healthcare has three major goals. So it is to have better care for the patient and to lower the cost and have the broader access for the patient to accessing the healthcare providers. So this goal sounds obvious, but in practice, they can often have conflict. Improving care usually require more times or more coordination and more resources. Expanding access often stretch the already limited workforce. And reducing cost can increase pressures to more with less. A useful analogy of these three-legged stools: if one leg is weakened, the whole system becomes unstable. This tension is the background for nearly every conversation about healthcare innovation, and including AI. See, the problem here is not we don't have effort, it's just a very complicated and complex problem to solve. See, in United States, for example, the government spends a lot of money per person on healthcare than most any other countries. Compared with other Western countries, we spent almost doubled compared with like Japan and some other Western developed countries. However, the outcomes, the health compared with wealthy countries, it is not always very good. Actually, in some aspect, it is actually at the bottom. For example, the life expectancies, the infant mortalities, and so on. So these things is like a very advanced hospital with excellent staff, but poor communications between department, outdated outflows, and duplicate work, paperworks, all this can add in the complexities of the healthcare quality and the accessibility of healthcare for the normal people. But this is not due to their lack of effort of the physicians. As you can see, the workforce is already very strained, and there are severe demand for the short workforce, and many people in the healthcare working field are very experienced and burnout. So as you can see, the data shows like more than 30 physicians specialists facing a workforce shortage, and about 1/3, actually more than half of the health workers experience some kind of burnout in recent years. So this lead to a very severe kind of challenges for the healthcare field. How can we improve this quality with limited human resources? So other challenges of healthcare systems, including diagnosis errors and misdiagnosis. Right now, compared with 20 years ago, the healthcare system or the patient experience is very different. So people just not walking into the primary care, they carried a lot of their diagnosis histories and lab tests and the other medical data. So these all kind of jump into the data systems for a patient, but there are limits of human beings who would be able to process all these informations. Though those could lead into diagnosis errors, or even they missed the diagnosis or error diagnosis can be carried on which has a future impact on the patient's outcomes. And also for the medication treatment, this treatment were usually standardized for a population but not personalized. So the physicians usually will follow the guidance. However, those kind of treatment may not be effective for a particular patient, and this lead to a cycle of trial and error care for individual patients. And also there are, as mentioned earlier, there are massive unstructured data like free text notes, PDFs, images, and wearable devices. All these data-heavy systems captured a huge amount of the data. However, it is very hard for humans to dissect those informations. So these all lead to the question, will AI be the solutions? I think it is true that we people have a lot of hope on AI. The promise for AI, it is very promising, but AI is not the cure for all. But it as I will introduce later, it is a very powerful tool to improve the diagnosis accuracy and improve the workforce efficiency. So before we dive into the actual definition of AI, and let's get into the history first. I think it is important to learn the history and then to see how people are imagining the AI, and we all at the beginning, and we can learn from them to see how we could envision AI in our lives in the future.